My name is John Clementi, and I'm a board member at Health Alliance Hospital and co-chair of the Cancer Center Capital Campaign. It's almost impossible to meet someone whose life hasn't been affected by cancer in one way or another. For patients and family alike, it's an incredibly difficult and stressful time. Cancer is tough enough without having to travel hours to access the best in cancer care. Being able to access exceptional care right here in the community is a major factor in minimizing the stress for both the family and the patient. Our community deserves the best in cancer care, and this initiative will provide just that. It's a community initiative that we can all get behind, and that's why I support the Capital Campaign and hope that you do too.
Lung cancer is the second most common cancer affecting men and women. It's a cancer that the healthcare community has been trying to find better and better ways to treat for decades. The trouble is, you can't look at someone and know that they have lung cancer. The National Lung Cancer Screening Trial found that if you look at people who've been smoking for more than 30 years of smoking 1 pack a day, or age 55 to 74, and people who are continuing to smoke and haven't quit in the last 15 years, you've got a group of people that have higher risk for lung cancer. We can use CT technology to screen those people, to look at their lungs and find cancer at its earliest stage when it can be treated and cured. For the people who participated in the study, 20% fewer deaths from cancer were caused by screening these patients for lung cancer. The other part of screening is making the screening test affordable and available to people. With the modern CT scanner, an early stage cancer can be found when it's as small as a grain of rice. By finding a cancer that early, you're able to offer the best treatment. The cancer at that point usually hasn't spread, and there's a chance for getting a complete cure. We're also able to cut the radiation dose to less than a fifth of what a regular CT scan has. Lung cancer screening is important because it offers a chance to identify the people who are most at risk for developing lung cancer and catch their disease at an early stage when it can be completely cured. Health Alliance is able to offer screening for lung cancer and treatment, as well as smoking cessation.
Smoking cessation is a big part of what we do here at Mass Lung and Allergy. We offer a lot of services and resources that can help our patients to quit smoking. It's a very, very powerful addiction, and it requires a lot of work to beat it. So we all approach smoking cessation in 2 main aspects. The first thing that we talk about is the importance of not only throwing out the cigarettes, but getting rid of the matches, the lighters, the ashtrays. They really need to distance themselves from smokers too. It's very difficult to quit if the people around you are smoking. Patients that are willing to do all of those things will then talk to them about the pharmacologic support options, and that includes various forms of nicotine replacement. The key to stress is that unless you're going to do all of those things, you shouldn't do any of them, because it's just not going to work. And so we really encourage people to get involved with the smoking cessation support group that we offer at the Burbank campus. Patients that are motivated to attend those support groups are often motivated to do all of the other components of the plan to help them not only quit smoking, but to stay smoke-free for the rest of their lives. And I think the important point to make is that by the time you develop symptoms related to a lung cancer, it is often at an advanced stage and very often much more difficult to treat. Go talk to your doctor. Get yourself screened with a CAT scan, and it may save your life.
I would like to take this opportunity to thank everyone who has supported and contributed towards the Simonds-Sinon Regional Cancer Center Capital Campaign. Our goal is to provide personalized, patient-centered, state-of-the-art cancer care locally, and through your generous contributions, we have been successful in implementing several such programs. My role as a medical director has been filled with patient care, identifying needs, and then working with the team to provide the most current and progressive services. Our team really extends beyond the cancer center walls to many services within the Health Alliance Hospital. Improving services in areas such as diagnosing breast cancers and lung cancers has been our focus. We have been able to successfully bring research, add clinical trials, start subspecialty tumor boards, expand our complementary services, and reach out to our expert colleagues at UMass. We have set very high standards to provide quality cancer care in this region. We have been successful in achieving most of our goals and have a wonderful program so far. This fabulous new facility would not have been possible without the tremendous generosity of our community, and on behalf of my team, I would like to thank you for all your interest and generous donations. We will continue with the same dedication going forward.
Today, I am cancer-free as far as we know. There is what's called no evidence of cancer diagnosis or report, and I got it. I've got to tell you, there is nothing like this cancer center. It is the people, and it is the care. And for those of you who have funded this cancer center, who have donated, I can't thank you enough for providing me this space. The environment is such that I grew here rather than deteriorated. I saw the future here rather than looking at what I thought I had lost. Because I really didn't lose anything through this journey. I just gained a tremendous amount of wonderful people in this wonderful place. So I thank you very much for supporting this center and for having this center here for the people of Massachusetts in this region. People will travel great distances to come here because it is the best.
This is a place where people can come and feel comforted and cared for, and that you're going to be taken care of. You're our first priority. I guess there are no words really to completely and totally express the appreciation and the love that I feel for all of these people.
But getting people to a place where you are right now is a big part of our job. And have you be able to come back and say how happy you are.
I am.
Yeah, 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 yeah.
What you do is you gravitate to the good.
Yeah.
And even if things are not good, there's always good. You just have to find it.